Hi there, I'd like to talk to you about trigger point injections. People often come in, and this is one of the most popular things we do for many people. They come in with a lot of pain over soft tissue in their body. And people say, what's a trigger point? Well, it's an area of soft tissue that typically often feels tight or hard or very tender to touch. It's almost like there's a muscle spasm under the skin. There's a lot of theories behind that. Some people say it's the muscle won't contract. Many feel it's because the little cutaneous nerves under your skin are angry and they basically won't relax. But the end result is, pain over an area you shouldn't feel pain. Good example would be, a very common area would be to get them up here in your trap muscles, here, your trapezius muscles. For most people, if you push on a healthy trap muscle, it just feels soft. It kind of like Play-Doh, it gives a little bit semi-firm. If you have someone with a trigger point and you run your finger over there, you're gonna feel a bump or something. You push down and say, does that hurt? They kind of jump and go, ow. It kind of triggers a response. It's very common after car accidents or people falling down the stairs, or old injuries will often get that kind of adhesive scar tissue. So trigger point injection is simply injecting usually it's a little bit of numbing medication, sometimes a little anti-inflammatory medication with a small needle over those areas of chronic constriction or tightness. And these are right under the skin. They're as simple as literally cleaning your skin off with a little alcohol, taking a small needle, finding that spot, injecting a little medication kind of in a pattern, almost like I would say it's like a grenade exploding. You want it to kind of hit an area, massaging it in, and just tell them to take it easy for a couple days. What I've often found is that if you can release that initial tension and that pain, it's much easier to get somebody to stretch, to do either a home exercise program or do some physical therapy so they can loosen that area up even further. You can repeat these injections if necessary. If they persist, we can try some other things, but sometimes a few trigger point injections in an area with a little bit of extra work often gets rid of them. People do very well.